Funding for regional transit authorities is making headlines, with advocates saying that the state is not providing them enough money. They say the funding gap is hurting those in the community who are most vulnerable and rely on public transportation. To better understand the issues and the impact, I sat down with State Senator Eric Lesser and Jennifer Lee, a systems advocate at Stavros Options Counselors in Amherst.
Yeah, I mean, every year we go through this as a Western Mass delegation, Carolee, which is, unfortunately the focus really on mass transit is on the MBTA, which we understand needs investment. We understand needs improvement. Nobody is denying that. But it's important to also recognize that we have several other transit systems serving everybody else in Massachusetts, in Worcester, in the Berkshires, on the South Coast, in the Merrimack Valley. And of course, here in the Pioneer Valley, we have the PVTA, which is the second largest mass transit system in the state behind the MBTA. Covers everything from the Vermont border to the Connecticut border. And every year we face, proposed cuts, and it's really devastating for our communities because people really rely on this service. And every year we have to work as a Western Mass delegation. Of course, we're proud to do that, to try to get that funding restored. And it's an issue that we find common cause with our other regional transit agencies. The bus services in Worcester, in the Berkshires, for example, face similar challenges. So we really rely on advocates like Jennifer and the Stavros Center to do the really incredible work of mobilizing the community and speaking out about how important this service is.
How is the funding set up as far as the PVTA and the regional authorities?
So it's done through a state line item, the same as every other state program. It's done through the annual appropriations process, and there's a central line item for what's called regional transit authorities, which are here in Western Mass. It's PVTA, but you also have the Berkshires Regional Transit Authority. You have the WTA, the Worcester Rapid Transit Authority. You have the Cape Cod Transit Authority. So basically all of the communities outside the MBTA service area have their own local or regional transit agencies that are funded through this line item, and it faces cuts every year. And it's important to also point out that line item is not isn't the only full cost. People still have to pay, and of course local communities here in Western Mass pay local property taxes and local funding support into the PVTA service areas to support that funding as well. And there's some federal dollars. So the funding is really a mix of the local fare box collections, local community investment, some limited federal money that does come in, and then a large portion comes from this statewide line item, which is a struggle every year to maintain.
Okay, Jennifer, why is this so important to you? And tell us a little bit about your work at the Stavros Center for Independent Living.
Yeah, so I'm the systems advocate at Stavros. I advocate for policy as well as do some community organizing work. A part of my efforts is to bring a community voice to the conversation, in particular a disability voice to the conversation of transportation. We continuously are advocating for more funding for transportation because we know that it's imperative to independent living for persons with disabilities. We've been serving persons with disabilities in Hampshire, Hampton, and Franklin County for over 40 years, with a commitment to independent living and a commitment to helping folks stay in their communities.
And how devastating would this be if this wasn't an option for people to have, this transportation?
Yeah, no, there are serious negative implications for transportation not being funded adequately. Transportation is imperative to health maintenance. People with disabilities have to be able to get to their medical appointments. They have to be able to get to preventative care. If they're not able to, that's not only costly for the healthcare system, but it's imperative to their overall health. Transportation is also important for employment, access to employment, access for social and recreational activities. What we're finding now is that people with disabilities, and seniors in particular, are more so vulnerable for social isolation. So having transportation that meets their needs to be engaged in the community is more important now than ever.
I think you brought up a point that, a lot of times when people think about public transportation, they're thinking about, the T in Boston or, the metro, big cities and stuff. And they're not thinking about how important this is, to people in rural communities. Yep. Speaking on her point as well, this is really important for people who just, don't have access to transportation.
It's essential, and Jennifer very eloquently laid it out, and we've worked with Jennifer's organization and a variety of other organizations to get that story told in Boston, because you're right, Carolee, frankly, there's a hyper focus on the MBTA, which is important and needs its own improvements and investment. No one's denying that. But, Springfield, Chicopee, Holyoke, Pittsfield, the 5 college areas, area, all up and down the Pioneer Valley, we have needs as well. It's also worth pointing out the PVTA serves a very at-risk population. A majority of the riders are under the poverty level. A majority are also people of color. This is really a ride of last resort. A lot of the riders do not have automobiles. So if the service gets cut, if someone's bus route gets delayed, they can't get to work. They can't get to the doctor. They can't get to school. And as Jennifer pointed out, they're stuck at home, which contributes to other issues like continued isolation, health risks from being isolated, and not to mention the drag on our economy because people can't be productive. They can't get to their jobs. They can't get to their doctor's appointments. The other element that I think is really worth pointing out is, you have two kind of areas where there's a lot of economic activity in Western Mass, or sort of up and down the Pioneer Valley. You've got the Amherst, Northampton area, of course, a heavy student population. You have Springfield, Chicopee, Holyoke as a more urban area. Connecting those two regions and making sure people can get up and down the Connecticut River Valley corridor easily and can get to and from work, to and from doctors is absolutely essential. And every time that they raise fares, we do see decreases in ridership numbers because people literally count their change to make sure that they can afford what they need for the bus fare. And that doesn't even begin to talk about how important the paratransit services are, the services that provide folks who might have a disability or who might not be able to drive themselves to be able to go about their life and live their life and be productive in the community.
Now, Jennifer, I know you've been working on this issue for a long time. Are there different ways, innovative ways that we can look at public transportation that might work?
I know that there is a pilot in the Boston area that's using Uber and Lyft as a solution to help get folks to medical rides, which I think is great. But in order to do that, we have to make sure that we're finding vehicles that are able to accommodate persons with mobility impairments, that we have an influx of accessible vehicles to be able to transport that population that may be significantly more mobility impaired and vulnerable to not getting rides. I also think that there has to be a continued commitment in consumer-driven services, regardless of what they look like, making sure that persons with disabilities, vulnerable populations, communities of color are at the center for advocating what those transportation solutions look like. So just making sure that whatever they may be, that there is a community voice and the rider voice at the forefront.
And so what's the next step as far as getting this funding to adequate levels according to what you...
So we're in budget season. There was actually a very substantial report and task force that was commissioned by the governor to look at PVTA funding, and a lot of community partners were part of that effort, and they recommended a $90.5 million funding line item for the statewide Regional Transit Authority item. We haven't been close to that. The governor's proposals in previous years and in this year were well short of that. We've worked to try to get that number bumped up, but I think our goal really needs to be to get that number to what's recommended, which is the $90.5 million statewide, because as Jennifer said, we want the system to be responsive. We want the system to work well. We want it to be efficient. Nobody would argue otherwise. A more efficient system, a more nimble and responsive system means better service, but we shouldn't use that as a pretext for cuts, because that cut will become on the backs of people who are the least able to carry it, and that's unfair, and frankly it's unjust in a society where mobility is really the ticket to health, to wellness, and to economic security.